Here with a very important 5 trials have been presented. I am going to briefly summarize these trials key points to you. After 2 years of the COVID, I think first time the 77th APICON, which is held in Jaipur, is in physical form, and we have a lot of people meeting physically. But I'm going just to take you to some important trials of the day 3. The first trial, of course, is the 5 trials we're going to take: a prevention of diabetic complication, the Indian Express. The second trial is early end organ protection in diabetes mellitus and hypertension. I think third was very important, relevant to our present COVID situation: new onset diabetes post COVID-19, and novel constructs of the type 2 diabetes in usher into the fourth trial, and reversal of diabetes by the V1 with the last trial. So let us first go to the first trial, prevention of diabetic complication in inspection by the Dr. Vijay Vishwanathan, actually was done on the day 3. Of course, we all Indians know the standard care should be available to all the people with diabetes. The aim of any healthcare system should be achieve this given. Whether many people may not be able to afford the new insulins or the newer drugs, but at least we can bring with a basic drug like sulfonylurea, metformin, which are easily available, at least minimal care at the lowest care that anyone diabetes can receive. This level of care is aimed to achieve at the limited cost of severe, because many of the Indian people may not be able to afford this high-end designer insulins or the newer drug like GLP-1 or SGLT, which are expensive. Comprehensive care includes most up-to-date and comprehensive range of health technology that can be offered to the people with diabetes with aim of achieving the best possible outcomes. Though we may not be achieving with a very high-end technology, but I think the basic minimal care should be available to all the diabetic people with limited resources. And I think delaying the progress of microvascular complications require intensive glycemic control, intensive blood pressure control, and lipid. I think 3 parameters here, not only glycemic alone, but the blood pressure is equally important, and third important parameter is lipid. Early detection and light metabolic control is the key in slowing the progression of diabetic microvascular. Because we have a very large population of diabetes with limited resources, at least we should appear to support them the basic needs and to bring down their HbA1c, blood pressure control, I think much easier, and lipid control. This trial was presented by Dr. Vijay Vishwanathan on the day 1. Now, next trial which we are going, the early end organ protection, diabetes mellitus and hypertension. I think this we all know, the diabetes and hypertension coexist, and both together can make a lot of problems to the body, heart, kidney, brain, everything. The co-occurrence of the hypertension diabetic patient considerably escalates the risk of coronary artery disease, stroke, nephropathy, and retinopathy, all the target organs. As per the site study which was presented by the Dr. Jayant Panda, which actually study diabetes, hypertension were co-prevalent in about 1/5 of the patient. Hypertension type 2 diabetes commonly holds the other severe risk factors such as microalbuminuria, central obesity, insulin resistance, dyslipidemia, hypercoagulative state, increased inflammation, and left ventricular hypertrophy, all leading to cardiovascular. So I think the diabetes alone, hypertension together, they will lead to multiple risk factors. This microalbuminuria is there, central obesity is there, which is common in Indians. Insulin resistance is much earlier. Dyslipidemia is there. Hypercoagulability state, because actually all these risk factors lead to the hypercoagulability and more coronary artery atherosclerosis. Inflammation is coming in a big way now. All the markers of inflammation are taken, and I think apart from this blood pressure control, diabetes control, and the lipid control, anti-inflammatory drugs also are coming important in the prevention of CVD, and left ventricular hypertrophy is an important marker by whether ECG or 2D echo, and can be detected early and can reverse it, can prevent the cardiovascular diseases. This was presented by Dr. Wango actually. Clinical evidence has shown that in diabetic hypertensive, tight blood pressure control is very important, as good as glycemic. In fact, it's much more than a glycemic control, because the hypertension control will prevent nephropathy, retinopathy, and I think cardiomyopathy along with the glycemic control. So don't focus alone on glycemic control, but the hypertension control is equally important. Identified by early, patient might not have any symptoms related to elevated BP. Many times, patients come to us at our clinic with normally feeling, but just on routine checkup, you find the BP is very high, because BP check at every visit of the patient is very, very important at a family physician level, at physician's level, because many of these people may be asymptomatic and may remain untreated for a longer time. If you provide them a good antihypertensive drug and bring down their blood pressure, we can prevent the future complication of cardiovascular disease, not only stroke, retinopathy, and nephropathy, all these things. That was the second trial, which was very important trial from the Indian perspective, because I think the blood pressure control is much easier because we have a very potent drug, and every and each patient, diabetic patient, needs a good pressure. Only problem with many of the hypertensive don't have any symptoms. They come asymptomatic, and on just routine health checkup, they find that the blood pressure is high, and they are very not aware of that, and they're very reluctant to take the starter drugs. So I think hypertension is very, very important control required in a diabetic population. New onset diabetes post COVID-19. I think new onset diabetes in COVID-19 has been reported from various regions of the world actually. We have seen with the milder cases of diabetes also 28% increased risk of subsequent new onset diabetes was seen from the patient who has recovered from the COVID, which are not in fact milder cases, not hospitalized. Of course, all of you know that bidirectional relation exists between the diabetes and the COVID-19. In fact, the diabetic population is more prone for the COVID infection, more complication, and COVID itself leading to the new onset diabetes, and more number of people who have recovered from the COVID will have a deranged glycemic control actually. And in critical ill patient, of course, there is a lot of which have been followed for 3 months. There has been a 18.8% to found to have a new onset diabetes because many of them have received steroids and so many other drugs actually, which might have caused the dysglycemia and maybe continue to be diabetic for. So it's in critical ill patient, I think the steroid use has been there, injectable or oral for some time, and these people definitely, but even milder cases, there is a good chance for that you might be developing a new onset diabetes. And this COVID has left a lot of bigger burden of diabetes in already existing burden, especially in India, where we have a large number of diabetic population. I think screening of all diabetes is essential at the admission and follow-up after discharge is very, very important. How does the diabetes develop? Pathogenesis is not very clear, but studies are required, whether it affects the virus directly to the beta cells of the pancreas, we don't know exactly, but there is a definitely increased incidence of diabetes followed by the COVID. It is essential to focus on preventive as well as therapeutic strategies for this, because this COVID is going to lead to another big burden of diabetes for all existing high burden of diabetes in Indian population. But I think every patient at the admission should be screened for diabetes at discharge and followed by 3 months later. Not only the critical or milder cases also should be screened for diabetes. That was the third trial. And these novel clusters of the diabetes in Asian Indians, I think this very new concept has come actually. What are the risk factors, the Asian Indian phenotype, the multiple, and I think this work has come from the V. Mohan's Institute, that Anjana has presented this. There is a low birth weight, and that is Dr. Yadnik's theory, which was there, thin fat. Inflammatory markers are high, abdominal obesity and visceral fat is there, low levels of adenopectin is there, lower age of onset of type 2 diabetes, which in India we get it at least 10 years younger than the Western counterpart, lower threshold of our BMI for diabetes, increased insulin levels in the insulin resistance, and typical dyslipidemia with low HDL, high triglyceride, and increased small dense LDL component, and increased prevalence of diabetes in a premature coronary artery. This is typical of Indian type, and greater ethnic susceptibility we have along with the genetic family aggregation and type 2 diabetes. Of course, which has been now divided into 4 different types of diabetes for the first time. India is South India. Clustering was done in type 2 individual using 8 clinically relevant variables actually. This actually comes from V. Mohan's Institute of Anjana presented. With a severe insulin deficient diabetes, this is SIDD. Mild age-related diabetes is MARD. And there's the Asian Indian population, the insulin resistant obese diabetes is IROD, and combined insulin resistance, and the 4th variety. So it's particularly important, it's characterized by difficult to control hyperglycemia and increased hazard. So there are 4 different types of actually which we know. One is SIDD, MARD, ROD, and combined resistant insulin actually. This is actually the 4 varieties actually with the 8 different variables. They have been able to differ. They all work in different way, and the management also will be different. So it was important to know this thing. That was the thing, and this work is very important from the Indian concept of managing the diabetes and the future component, because there is a severe insulin deficient people are there. We will require insulin. A very different drug they will require, which will be mild age-related diabetes, something different, MARD, and the insulin resistant obese diabetes, IROD, And the fourth one is combined insulin resistant type actually. These are the four varieties of diabetes, actually this paper. And of course, reversal of diabetes. I think the word from remission of diabetes to reversal of diabetes has come very recently, because we don't have a remission of diabetes. Actually, it never goes. Whether the bariatric surgery or significant weight loss has brought down the reversal of diabetes, not the remission of diabetes. So I think type 2 diabetes has long been regarded in a very progressive, requiring increasing number of oral hypoglycemic agents. Actually, usually cycle is that the number of years progress, the number of drugs added, and ultimately they are on insulin dependent. This actually was a concept so far, but I think some of these newer concepts have come where we can at least achieve some amount of remission in diabetes. This even in one way restoration control has been interpreted to mean that the condition is treatable but not curable or reversible. That's one thing very true. The curable or reversible claim should not be made. Only if we can achieve a remission for some period of time, it may again come back with us actually the aging process or the weight again gaining or whatever. Stress reduction, wherever appreciated, very low calorie diet, low carbohydrate diet, intensive physical activity, all that can. 50% individual require insulin failure when the usually progressive disease within 10 years, because beta cell get exhausted. But this remission concept has come with a good amount of diet, physical activity, stress reduction, and of course significant weight reduction, aggressive treatment after the initial stages. All then can bring down some amount of remission. I think now the newer GLP-1 oral drug probably also might help us to bring down the significant weight and a remission possible actually, because and bariatric surgery used to claim this thing. So conversions of people to type 2 should include remission, the word, not the reversal totally. Dietary approach to achieve remission is less important. Less calorie diet and low carbohydrate can be equally effective, but physical activity is also important. Programs supporting people to achieving remission need to be structured and offer continued regular support, including the involvement of a dietitian for a long-term surface and the physical activity with good amount of diet control, reduction in the carbohydrate diet, less calorie diet, good amount of weight reduction, some amount of physical activity. All that can bring down remission in at least early stages of diabetes, but not the reversible is not the word actually we should use. So I think the 5 important trial, the last was by Dr. V. Mohan, Dr. Anjana, Dr. Jan Panda, and Dr. Vijay Vishwanathan, and Dr. Wango. All these people have presented very, very important trial from the diabetes point of view. I think that's very, very important, relevant. I think first trial is every patient should be treated whatever possible drugs are there. The important concept came the COVID and the diabetes. I think the COVID is going to increase the number of diabetes people to us. And this reversal of diabetes is again important. And those 4 different varieties of diabetic actually are very, very important. Become the management of the diabetes will change to us actually. And this is these 5 trials were very important from the point of view. And of course, end organ protection, again very important trial, because with the good control of not only the diabetes but the blood pressure control and the lipid control, we can achieve very good prevention of the target organ protection or the complication of diabetes like nephropathy, retinopathy, or stroke, or the cardiomyopathy, or a coronary artery disease, if you take care. And I think the blood pressure control was very, very important, because many people are not aware of that. And I think every visit we should check a blood pressure very well and put a good amount of drug and bring down the target of the blood pressure level and the lipid level, along with the glycemic control. If these 3 things are achieved, many of these complication mortality can be reduced in the diabetic population in India. Thank you very much. Thank you.